Hey, Dave Kittle here. Welcome back to the Dave Kittle Show. I am the owner of Concierge Pain Relief Home Physical Therapy in New York City and the Fieldmaker Group CEO. We're currently speaking with practice owners in regards to partnering or acquiring some or all their practice. And today I have one of my physical therapy practice owner buddies, Eric Broadworth. He's based out of Grand Rapids, Michigan. Fuel Physical Therapy, now rebranded to Fuel Health and Wellness.
Yep.
Eric,
how's it going? Thanks for having me on.
It's always a great time catching up. Back in the days of you going from your full-time job to a cash practice, I'm super proud of you, man. Pumped to get you back on the show. We're going to be talking about a bunch of things today, but specifically red light therapy and some of these numbers, some of these like revenue numbers. It sounds a little crazy, but we're going to get into it because I know that you know your stuff and you provide solutions for your patients and clients. And so we're going to be covering how Eric added $15,000 per month in red light therapy revenue, totaling $186,336. I guess it was last calendar year. Pretty interesting stuff. It's not the normal treatment approach or the offerings of a physical therapy office. So just give a little bit of a background. Anyone watching, listening, if they don't know you, a little bit of your history with Fuel, a little bit of before adding red light therapy, and then we'll get into the main topic today.
Yeah, absolutely. So thanks again for having me on here. So first of all, Dave, we kind of been working together since about 2018. So 5 years, it's crazy, but you were one of the first mentors that I had in the cash PT space. So when I was looking at starting up my own mobile practice and stuff, you and Ron Miller got connected with you guys, and you guys provided a bunch of insight. So I was able to, because of your guidance and the things I learned from you guys, leave my full-time job as a center manager and go full-time. And it was Fuel Physical Therapy and Sports Performance. We've rebranded that to Fuel Health and Wellness. We still obviously do physical therapy, but we do so much more. And that really started with the red light therapy stuff. So like most physical therapists, I have always been more, taking an active style approach, do some manual stuff, but really get people to be active and try to follow the science as much as you can and do evidence-based practice, all of that stuff. And so I first heard about red light therapy in 2021. So Todd Wickstrom, who's one of also a mentor of mine and business coach, he told me about it. And I was extremely skeptical. I'm like, you're telling me shining a light on someone is going to make a difference. Doesn't go with anything I've never learned about in school. Doesn't go with anything that of my treatment philosophies. But he said, look at the research. I recommend that you get into this or at least look into it. So come to find out there's 6,400 different studies on how red light therapy has been used. Most of it is, there's a lot of animal studies and a lot of studies that are small and stuff, but clearly stuff works in some capacity, right? And so the more I looked into it, I decided to take a leap, just kind of like I took a leap with my business. And it's been crazy. Like patients love it. We do get results. And it's really helped separate us from competitors and help to add value on why I can ask for more money, because we're not cheap. If you want to, price shop around, I'll tell people like you can go find cheaper. We are meant to be a high end. Yeah. If you want to you can go find cheap. We're meant to get you better though. So like if you want to reach your goals, whether it's pain-free, weight loss, whatever it is, because we do so many things, the weight loss, the assisted stretching, the physical therapy. That's why we rebranded, and it all started with the red light, but we got a solution for you.
Got it. So obviously anyone watching or listening, if they're a physical therapist or someone in healthcare, like you mentioned, skeptical. So I appreciate you mentioning that. Also, you can share, if you want to share like the ebook or any other content or anything for YouTube, if there's any other things you want to share, feel free to let me know, share the screen.
Yeah, I'll give you the PDF. You can put it in the description of the YouTube. And then if anyone, I'm on Facebook. I'll give you my email and whatever. If you want to get a hold of me, just shoot me either a DM, email, and I'm happy to share a PDF with a lot more info on it.
Got it. So did you you were interested, you were curious about it. You talked about results. You started using it in what capacity? Like you dabbled in and you bought, I saw you somewhere you said that you took out a loan for this. So did you maybe buy a smaller unit or two first and kind of see, maybe
yeah, I
use
took
up,
out two.
you've had a bunch of injuries. Okay. So
yeah, I've had a bunch of injuries. I took out two loans. These are my only business loans. So other than this, when it came to fuel, it's all been, I purchased a treatment table. I've done everything, like been able to pay it all off. I mean, this stuff isn't cheap. I paid $30,000 for the set of pads, and I started with that because the red light beds are a lot more expensive. They range from like $60,000 to $100,000, 100 plus. So I said, let's get my feet wet before I really jump in. And the pad system, we got so busy so quick, and I knew, I'm like, okay, we're going to have to probably invest in another one here if we want to get it as busy as we, want to get it. And so that's where we ended up purchasing a bed. We bought the pads. We got that going August of 21. I think we got the bed in May of 22, something like that. And the bed's just the reason we got that. It's easier to clean. People can set themselves up easier. So there's pros and cons to both. But it wasn't a cheap investment, but me, Dave, like I'm dead serious when it comes to business. And when it like comes to pulling the trigger, like if I'm going to pull the trigger, I'm going to pull the trigger and go full throttle with it. And we're going to make it work. And that's what I've done with this. So these are my only two business loans, but I 10X when you make the numbers work, it doesn't matter if you take a loan out. If you're 10Xing your money on that, why would you not do that? That's how I look at it.
Got it. So you looked at a bunch of the research. You looked up the 64 or whatever different research articles, or maybe it was shared to you.
6,400.
Oh, 6,400.
Yeah, I did not look up all of them, but I looked into them. Yes.
Then before taking out a loan for red light therapy to buy this unit, did you talk to your patients and clients? Did you ask them, or did
it was stupid? No.
What did you like? So how did you know? Like, how did you do any you didn't pitch anyone like a package before you even had the device. You didn't do any like pre-sales or anything.
I to be honest, like I was scared because I didn't know. Like I didn't want to look stupid to my patients and clients in terms of like what you have that. What if it doesn't work, right, in the back of your head? And so I have a completely different approach on how we use it now, but I only advertised it to cold leads on Facebook. I mentioned it to some people who like really were like my super fans that like, know, and trust me, that I have a really good relationship with, and let them try it to see how they like it and dabble with it. But everyone else, it was cold leads on Facebook only for weight loss, because that's what I was kind of told to do with it. And I wanted to see how it worked with those people before I started then implementing it truly into like a rehab setting. But then the more we started to implement it, it's like, okay, this affects both. And why would I not use this on warm leads? Like once I saw that, okay, we can get results with this, why would I not use this with warm leads? So now like we use this with 95% of the people, I would say, who come to Fuel for physical therapy or weight loss.
So let's say I come to you, if I was a patient, let's say I had like back pain or something, or like a weekend sports injury. I play baseball on the weekends, trying to, stay active.
Yeah.
What's the, like, so I call to make, I see, like, let's say I found you guys on Google, or a friend referred me to you guys, and I'm calling up for back pain for physical therapy. When is that introduced? When, and I do want to get into the results of like what people get, whether fat loss or whatever, but when is it introduced in the whole process?
So for physical therapy services, we're primarily cash-based. So we're comp and auto, we'll bill those insurances. That's it. The rest of it is cash. So that I would say is really 90% of people, 80 and 90%. And so when it comes to those cash people, we have a discovery visit. We take them on. We did, 20 or 30 minute consultation, evaluation, pain relief treatment. They don't get it that day. We tell them about it, and then we get them on for the full eval, the hour-long session. We do explain to them, hey, we're going to go. We're also going to throw in red light therapy for free on that session, and that's going to help us determine, one, how you do between now and then, how many sessions you're going to need in total. So then when we then we get them in for the eval, we determine how many sessions they need. We quote that into the price. So, I mean, we're asking for, on the low end, $1,464 for 6 sessions. A lot of people, 12 sessions, $2,988. So that includes the PT and the red light therapy. However, if you kind of notice, if you're a PT owner and you're watching this right now, you need to know your numbers and what the total cost. We don't do, hey, do you want to add on red light therapy? Because people go for the lowest cost, right? They want, well, I don't know, it's fine. And so I'll downgrade from there. I'll downsell them if I need to. I don't often need to. It's normally included in the price, and we charge $249 a session. So it's $50 a session for 10 minutes on red light.
But you charge $249 per session, you're saying?
Mm-hmm.
If the package is broken down.
If you break it down per session, yes.
Yeah.
And that's $50 for red light is what which is 10 minutes.
Got it.
So you can make, usually if you're doing all pain relief, protocols can vary for pain relief and weight loss on how it all works. But say you're doing all pain relief, I can fit in typically 4 to 5 patients in an hour on red light. So 50 times 4, that's $200 an hour on the low end. And that's like passive income. Like I put them on, press a button. I don't have to do anything more than that. $250 if I'm getting 5 people in.
Got it. So whether it's for weight loss or helping with blood flow and circulation or pain relief, like what's some of the science here? Like what's actually either actually going on or potentially going on in terms of like the effects of being under red light for 10 minutes?
Yeah. So there's a lot of, so if you really want to geek out into science, I really recommend, it's a book called Low-Level Laser Therapy by Michael Hamblin. And he takes and breaks down a bunch of, if you want to get into science, that book is for you. And he'll break down a bunch of conditions. And he's one of the lead researchers when it comes to red light therapy is Michael Hamblin. Basically, long story short, and how it happens is our cells in our body react to light. They'll react to like blue light, red light, green light. There's different light therapies. Red light, it's that wavelength specifically, which is 600 to 700 nanometers. And then near infrared light is typically, the therapeutic range is 800 to typically 1,000, 800, 900. And that wavelength will stimulate the mitochondria of the cell and help it be more efficient at producing ATP, because through the cytochrome C oxidase receptors basically on the cell. So if our cells are more efficient,
is it the handbook? Is this it?
On
Amazon?
That's the first edition. Go up. That red one right there, the $69 one. That's the one I have.
And yep. I'm sharing the screen here on YouTube. If you're listening on iTunes or Spotify, you can jump over. So low-level photobiomodulation is the really scientific term that if you want to look up the research in Google, like scholarly articles, use photobiomodulation or low-level laser therapy. But that book is awesome. Yeah. So basically, though, by making the mitochondria more efficient at producing ATP, you're having this full systemic effect on the body. So that's why you're able to have improvements in the mitochondria react to the light, and basically those wavelengths make it more efficient at producing ATP, which is obviously energy for the body. So that's why there's all these systemic effects. Red light can also make the fat cell membrane of your fat cells more permeable, so the fatty acids and lipids can leak out into the interstitial space. And so that's where you can kind of, in a sense, shrink fat cells, is how that's working. That's very broad layman's terms that I use with my patients. But that book goes into it. And then we have a whole protocol that we'll usually put them on depending on what their issue is. So we have one for neuropathy, one for weight loss, one for pain relief. Yeah. Have you had any stories of patients or clients that were skeptical and you offered them a trial, like the first session was a trial, so it sounded like you often would do that, maybe the first time they get to try it for free, and then they reported, not you saying it, but your patients or clients reported feeling some positive effect after just the first 10 minutes? What are some things that they've said?
Yeah, the biggest thing so some people notice an immediate improvement. Some people, it can take a little bit. So typically what I tell them to look for immediately are improvement in energy levels, improvement in sleep, decrease in pain. So if they have shoulder pain, have them move their shoulder before they, use it. Get in, do the red light therapy, get out, move their shoulder. Oh yeah, hurts less. Or if it's their back, bend forward, do whatever. Make sure you're testing and retesting things just like anything. When we do weight loss, we measure inches and get their weight and body fat percentage. So I definitely recommend testing and retesting. Otherwise, you don't know if you made an improvement, right? So, yeah, I mean, we still do what I call a crazy guarantee. So we have a money back guarantee. It's once a year maybe that anyone takes you up on that. It always pisses you off when they do take you up on it, but I give them their money back. I don't need a bad. If I tell them that, I'll give them their money back. Most people, though, very happy with it and how it works. So,
how many sessions would you have allowed someone to do? Like whatever your consent form says. Like, how many sessions can I try? I pay for a package. Can I try X amount of sessions and then I get my money back guarantee? Or did like the one person a year? Is it like they've tried like 5 or 10 times and then ask for their money back? Because people are afraid of.
We've changed our money back guarantee. Yeah, so we've changed our money back guarantee, especially when it comes to weight loss. So because the people who take the money back guarantee typically are like, they're your pardon my French, pain in the ass people who like they want things for free. They want the easy way out. They don't want to do their home exercises. They cancel on you and all of those things. So I've talked with my staff about it, and we'll do a money back guarantee, but you have to show up to all of your appointments and you can't cancel or reschedule them. If you do that, money back guarantee, no problem. But you have to commit to the plan. So if you're not doing your end of the plan, you're not going to get results. So we've changed and made that stipulation just because to help with people holding up on their end of the bargain. Because I am confident you hold up on your end, we will hold up on our end and we will produce results.
In that type of a game plan or a plan of care that you're laying out, it's typically they're getting physical therapy visits plus some of the red light, or do you have some people that are coming for red light therapy only?
We have some people who come for red light therapy only. Pros and cons to that. So we'll do like, we've been trialing for a little bit, like our unlimited package, and it's a very decreased rate where they come in, they use it for 10 minutes and then they get off and go on. So those are people who, maybe are looking for, they don't want to commit to PT. They're going to physical therapy elsewhere and they want to do red light therapy. But honestly, like if you can make it work from a dollars and cents perspective, like I have someone else at the clinic and push a button and get them in. And this is more effective than putting a hot pack on them. Much, much more effective. So, and they love it. So we do that where we've got our unlimited plan, but the key is it's a subscription base. So when they sign, they're committing to a minimum 3 months and then it auto renews every month. They got to give us 10 days notice is what we have them sign on. So kind of like a gym membership or whatever, but, and then what they can cancel after 3 months.
Why not just do it monthly and say unlimited per month and it just charges my card each month like a traditional gym membership? Why 3 months?
Because I want to make sure that they're using it effectively. And you just get the people who like don't try it enough. Does that make sense? Like if they have a long-term issue, it's not going to get better overnight. So using it for 3 months you're not going to overdo it. And then if they want to cancel, they can cancel. And there are some people like, you're the business owner, make your own rules. Like if you want to go about month by month, you can. I do the 3 month, it increases my lifetime value of the patient or client, right? So I get more money committed. With the rate that I'm giving them, it's for me not worth it to do it month by month, and they cancel after 1 month. I'm losing out on too much money right there and giving away too much of my time.
Got it. Are you comfortable sharing, like, what is the dollar package like for 3 months of unlimited red light therapy only?
$219 a month times that by 3. So it's a little over $600.
And
so
no like payment plan, just like all up front?
Oh yeah. $219 a month. You need to pay that all up front. No payment. You can we'll take care credit. So if you want to put it on your care credit, that's fine. But you better be able to afford $219 a month. If you're having to haggle with $200 a month, then you're with the wrong clientele. At least that's for people that we work with.
Right. Got it. So then in 3 months, then it would just like auto renew for the next 3 months.
Oh, not for 3 months. It auto renew 1 month at a time.
Oh, okay. So it's really like, it's like a 3 month, like you're making sure you get like buy-in, kind of like they're committed.
Oh yeah. So they don't have to owe the 600 some. It's $219 a month. Like whenever they sign up, our system will bill them on that date of the month. And then they're signing their name that they'll commit to 3 months. And then it just keeps auto renewing until they cancel.
Got it. Okay. So you've already been testing that last year, 2022, or just this year, 2020?
Just this year. That's new. Yeah.
Got it. When someone's in it for 10 minutes, like, I haven't tried it. I need to. Is it actually hot, or like, do you perspire? Is it kind of like a sauna? Like, what does it feel like?
Everyone's a little different. But yeah, it's how your cells respond to it. So like, it's not uncommon for people to get hot and for them to, perspirate and sweat. Some people sweat pools, like it's crazy. And you're like, I'm taking and mopping it up after that. It's that can be a little gross when people sweat that much, but some people will. Some people won't sweat at all. It can kind of depend, but that's not uncommon. And usually people feel like super relaxed. Honestly, when I get on, I'll try and like meditate a little bit with it, but I feel like I'm so like zen afterwards. It just feels really good.
So they're doing this supine and then prone. They got to flip over and get seated, or
I guess you could do it either. I just have them supine. We lay down. So with the pads, we have them on a massage table and we wrap their body in these pads. And we'll do like full body that way. For the bed, it's literally like a tanning bed, but there's no UV rays or anything like that. So we just make sure they're not claustrophobic, show them how to get in and out of it. And they close the lid on them and it hits full body that way. So, yeah.
So even though they're supine for 10 minutes, there's red light therapy posteriorly as well.
Oh yeah, it's underneath and above. So it's like, this little bubble. If you check out the PDF document, I put different like YouTube videos out there too of me like on red light system. You can check it out. So if you go to like the Fuel Health and Wellness YouTube account, I've got a bunch of different videos in there, but I do have the different red light shorts. Like there's I'll just show like this is the pad system. Just kind of looks kind of wild.
Got it.
But yeah.
So you have like a little bolster under their knees so they're like comfortable for the 10 minutes.
Yep.
And they're on, you said like a treatment table, like a massage table?
Yeah, with the pads. Yeah, massage table. I bought one for $300 on Amazon, and it's like the most comfortable massage table. It's way more comfortable than the high low that I bought for $1,000 some. So super comfortable. The bed can be, it's an acrylic that you're laying on with these lights. So that can be a little more uncomfortable. So I usually don't prop their knees up if they're in the bed. I will if they have back pain really bad and need it, but usually they're just laying flat in there. We'll give them a pillow sometimes if they need it, if they're like super kyphotic or forward head posture. Some of your older people, but otherwise they're just laying down, throw some goggles on and kick back, relax.
Got it. So what else have you learned? You said you ran Facebook ads to a cold audience there in Grand Rapids, Michigan. So cold audience for weight loss. Now you're offering it to your physical therapy patients and clients. Yep. What else have you learned in terms of like...
We're doing neuropathy now.
Okay. So on their feet?
Huge. Yeah. Neuropathy is huge. I mean, and we're selling $6,500 neuropathy packages. So there's a lot to it. We have them doing more than just come in for red light. We have a whole protocol and like home kit that we give them. But that's been a really good, and it does help. Like I'm not just selling. I'm not one to be like a snake oil salesman with this stuff at all. We actually had a guy come in. He purchased like a home therapy kit from a chiro about hour and a half away from us. And I saw some of the stuff he was doing. And I'm like, I said, you get a money back guarantee with this. You need to be doing these other things with it. Cause he's like, he wasted $7,000, spent $7,000 on this, didn't really see results. And
what was the other thing without saying, the other practice? Like, what did he buy for $7,000?
It was like a red light therapy device for his feet. I think they gave him a supplement, and I think they might have given him possibly like an e-stim foot bath thing, so some of those components our home kit has, but he was missing so we'll also recommend vibration plate therapy, which we have in addition to the full body red light therapy. And then with our protocol, we also utilize stretching and exercise services. So we're truly treating like the whole body. And he was like, and I made sure I followed up with him. I was like, hey, are you noticing an effect? And he's like, yeah, I'm feeling a lot better. So he was happy that he didn't waste more money like he kind of did, with these other people who, while they had a similar type of device, they kind of said, good luck, take in good luck, so we want to make sure we're getting actual results with people. But yeah, neuropathy is a really big one too. But yeah, you can use it for pain relief, tissue healing, anti-aging, so wrinkles, fine lines, so cosmetic stuff, cellulite, eczema, psoriasis, alopecia, balding. Yeah. And with those things, they don't seem very physical therapy like. However, it's a problem for the person if they're willing to spend money on it, right? Like for a lot of people, their appearance is a lot of things, and this will help with that too.
In the research or through Todd Wickstrom or any other, like the books that you mentioned that you reference here on this chat, any side effects? What's the downside here? Are there downsides?
Not really. That's one of the great things. I had one lady recently who said her pain was worse after. I always then question though, and I didn't talk to her, my staff did, and I want to make sure that they're following up, but what else did you do that day? Really dig in. Cause it's like when people come in and it's like, oh, I went in and saw you for back pain or shoulder pain. I had a lady, this is years ago, I always use this example. She came in for shoulder pain, and then she comes in the next session. She's like, yeah, I'm so much worse and in so much pain. I'm like, well, why are you worse? Come to find out she's shoveling rocks and she's got like a rotator cuff tear. I'm like, okay, well, it wasn't what we did. You're shoveling rocks out there. So it might not be something that obvious, but people, you can't just take them at their word. You have to question them. So did they do something different that maybe it just didn't click, that's likely what caused it? Two patient populations I wouldn't use it with: cancer, pregnancy. Those are really the two big ones. And really, it's just because we don't know enough. There's honestly research coming out that this can help with the side effects of cancer. This actually can be beneficial for cancer. But one of the fears is that if you're stimulating the mitochondria and everything like that, are you going to make the cancer spread and metastasize? So there hasn't really been anything to confirm that. And actually, they've shown improvements overall, but you need to get a physician write-off for me if you want to do that. And that's kind of on you. Pregnancy, same kind of thing. We don't really know. So you can do more harm than good, potentially. My wife's pregnant. I'm not going to have her doing red light therapy till afterwards.
Got it. You previously you started and it was like just cash-based physical therapy. So like traditional physical therapy, manual therapy, orthopedic base, you were doing sports performance. Then at some point, you added the stretch therapy. And I'm not sure, I can't recall if one of your team members, like if they're all PTs or if you have like some trainers or LMTs, like massage therapists doing it or not, I don't know. But what in your practice is like with people buying packages for the stretch therapy or fascial stretch or whatever, assisted stretching, whatever you want to call it, this whole thing now, this craze, is red light therapy beating, like in terms of like usage and like potential revenue range, is red light therapy beating assisted stretch, or are they like both similar in terms of like your buckets of like revenue? It's like your traditional physical therapy services, and I know now you kind of like add up other things in it. Now you're adding in it, but like, is there a way to differentiate like which one's doing better for your practice versus the other?
So yeah, the great question. Red light therapy in terms of revenue is beating out assisted stretching. Yes. However, I will say like the reason I've added these different components is to solve problems for people and figure out, as physical therapists, we're, educated to get people better quick and then send them on their way. Why? Why? So as I started to question that on that why do we get them better and send them back? One of the prime examples that I give is I had a guy who came to me and for an Achilles issue, calf issue, Boston Marathon runner, dry needled him, got him feeling better, everything like that. One session. Okay. Got him feeling better in one session. Sent him on his way. I'm like, if you ever need anything, don't hesitate to give me a call and we'll get you in. And I just assumed this is minor. He doesn't need a bunch. So fast forward several months later, I see him on Facebook thanking another PT who got him through Boston with his injury, same injury. That's on me for not following up with this guy, for just assuming that he's going to get through this injury and he's going to call me back if it's not better. Why do we try to get people better so quickly? I agree, get them better quickly, but then we need to make sure we're truly, like, if we are the musculoskeletal experts that we claim we are, and we're all about being proactive, why are we not doing that after the fact? And so the stretching, the personal training that we offer here, the red light therapy, it's all about a holistic care, truly holistic care and full body wellness. And once we get them out of pain, how do we keep them out of pain and injury free? And you really need to tailor this to each person, like listen to them. But what we do is when they're done with like physical therapy and they're pain free, but they still have some mobility issues, hey, try the stretch. We're going to try it for one session. No, there's no commitment. If you like it, you can buy a package. If you don't, no big deal. Most people love it though, and they continue doing it. And we'll, sometimes I'll strongly recommend, hey, your hips are super tight. They're not getting any better. You need to stay on top of this. I strongly recommend that, meet with Nicole, see how you like it first, but go in from there and stretching or Kayla, she's our other massage therapist and does the stretching. But we need to just think outside the traditional box. And that's what I've really tried to do with Fuel.
So that example of that runner who you helped with dry needling and probably some manual therapy, whatever you might have done with that individual, one session, they felt better. And I love how you're taking accountability on that, because I've been there so many times myself. And it's like, if then they're thanking some other physical therapist on Facebook, and that could or should have been you in a way. And you're saying it's on you for not following up and making it easy for consumers or patients or clients to be reactivated or come back in, even if it's now, it could be automated. There's other things now. Chad Kuntz and all these other folks are like doing these things with text and automated emails, but it certainly could be manual as well, coming from you or just like someone from your front desk, like with your system, like, following up with folks and patients. What should you have done? Like send them like something every week, that person, to try to get them back in, or
I should have that session.
Some owners don't want to oversell or like bother patients or clients. So what should you have done, you think?
If I could go back in time, how I would have done it, I would have set up another session, whether it's a week or a month, 2 weeks, month down the road. And I would have said, hey, let's schedule this. Let's put this on the books. And we have people pay up front. So that way it decreases the cancellation rate. Pay up front. If they give us 12 hours notice and want to cancel, we refund them their money. So I would have said, hey, let's get you scheduled for, one more. How's this date work? Perfect. And let's just stay on top of this and make sure. And then if you're feeling great, you need to cancel, we can cancel. At the very least, in my opinion, PT owners should be doing that. Even if you get them better, set them up for do 30-minute sessions, 15-minute sessions. It doesn't have to be an hour. It doesn't have to be true like traditional PT, but do a little bit of body work, which they like and they can't do themselves.
A little tune-up, a little check-in session.
Exactly. That's not, and to me, I mean, you can argue that, I think you can argue that's greedy. I disagree. I don't think that's greedy. I think you're being a coward if you can't do it. So let's reframe our thinking. Is it because you truly think that they don't need it, or you're afraid to ask for more money and you're afraid of that they'll say no to you? Because if you're afraid, that's not them, that's on you. So are you really? And yeah,
I put out another episode, a solo episode weeks or months ago about not saying the word discharge, and kind of like my practice, like we might pause, or someone is good on their own and great, they're back to the gym, they're back with their personal trainer, whatever, great. But like we don't like to, and I know Jerry Durham puts out stuff like this of like, physical therapy or healthcare is like the only niche or industry or business that fires their customers, or patients or clients. So we just prefer to not use the word discharge, and we'll say, you've graduated your plan of care, or in your case, like you've graduated or you've completed your package or whatever, but not like discharge, like have a nice life. And like, yeah, like maybe reach out to us anytime. And like, they might do that. Right. Or they might see some other Facebook ad or some other physical therapist or whatever, and they might go that way. They might go to someone else when they could have come back to you. I want to circle back on something. So you were saying either in the pre-interview or in the beginning that you listen and you solve people's problems, or you're trying to offer services and you're offering products, or in this case, services, to ease their situation or their problem. So what were people saying? What were patients and clients saying at some point that you thought the red light, because you did pony up a lot of money, you took out a loan, you took some amount of risk, you knew that there was some amount of research and proof and science to back it up. You know that you and your team have the conversational, ethical sales confidence to kind of like present this as an option. What did you hear over the past several years? I mean, you've had your practice now for 4 or 5 years or something. What have you heard historically that people were complaining about or mentioning that you thought maybe this red light would not be that risky? It would be something that would actually solve some of their problems.
Yeah. I think, well, one, I'd always been a little bit interested in like the class 4 lasers. That was kind of one thing, which is another form. It's more intense. And what we have like doesn't require a medical professional. So I can pay someone $15 an hour to run it. I want to work on my business, not in my business. So that's one of the reasons I went that route.
So like instead of like the light force laser or the I looked at the MLS 360 or 540 or something, and they're all like pretty expensive as well. Like they're like $50,000, $50,000, $70,000.
Same cost, except for then I have to be the one doing it, or I have to hire another PT to do it, versus I can hire someone else and not necessarily have to pay them as much. And now I have, so from a business owner perspective, better profit margins. And again, that's just my goal is I want to treat because I want to treat, not because I have to treat and because I'm tied down to this to make a living being forced into something. So that's on me. In the future, maybe I add a class 4 laser, but I'd want someone else to be able to man it and not just me. So that was one of the reasons. You get so many people too who, ultrasound, hot packs, e-stim. When people want these things, like it's not going to hurt them. Why not offer it to them? We don't offer, hot packs, cold packs. We don't do that. I'll educate people and say, hey, you can do this on your own. That's not skilled care. This though is something that, looking into it, it's a modality. It feels nice, but it's also effective in getting people to feel better and get them towards their goal that they they're not going to go buy a $60,000 piece of equipment at home. You have different home units now. So if someone wants a home unit, I will direct them towards like a Mito red light or something like that. But I'll also educate them like, hey, those are great. Here's why, this is better, and you should still come in for the full body. You're just not going to get the same effect necessarily. You can still get a good effect. They can be very nice, the home units that are a couple $100, $1,000, whatever. But the full body one that we have is definitely like more medical grade.
Right. And I know we covered side effects, so no one's complained of like burns, skin irritation, dry skin.
Okay, burns. I had that happen one time, maybe two, and I called the manufacturer. I was like, "Whoa, what's up with this?" This dude he got some blisters, and so I always check in on them now, and I'm like, "You need to tell me if it's getting too hot. I can turn it down." So I always, that was only with the pad system that I have. Luckily, they're like, "Oh yeah, like no big deal." So you come across the wrong person, though, you might end up with a lawsuit on your hands. Yeah. But luckily, that wasn't the case. I did feel really bad and everything like that, but it was nothing life threatening. He had some blisters, but we got that corrected, and I contacted the manufacturer right away. I'm like, "What's going on here? Why did this happen?" So we've got that fixed right away.
So fixed how? Like you dialed down the intensity for a lot of people? How?
Yeah,
do you like maybe make sure like better screening and saying like people that have some sensitivity issues, or like how did you fix it?
No, so one, anytime that it's their like first time on it, like we'll check in with them like halfway through to make sure you're still comfortable, everything like that. Perfect. Because those people are usually doing like 20 minutes. And then two, making sure that the pads are plugged into the right part of the power box and console. So apparently the smaller pad, and they didn't tell us this was the issue, was plugged into the wrong port, and none of it was labeled. So you figure just plug them in and turn it on kind of deal. So we learned on that, and so luckily it was okay. But for the most part, like that's really been the only time. Like I had one lady complain that her shoulder pain was worse. I think it was how she was positioned possibly in there. And it wasn't anything major. She was just like, "Oh, my shoulder pain is worse." I've had hundreds of people go through it now. It's one person out of hundreds. So you always have your outliers.
So I think I saw somewhere online or Facebook, you said like maybe 90 or 95% of your physical therapy patients and clients go through red laser. So you pretty much like, you just offer it like, and if they don't want it, then you'll knock some of that, like the $50 off per visit. But really it's like your offering now is like, it's part of your overall health and wellness plan. Like it's like, yeah, we do physical therapy. We might do, whatever, joint mobilizations, that like the hands-on things that like no one even knows what we do, but like that's how we get someone better. Nerve glides, whatever, joint mobilization, soft tissue work, whatever it might be.
Yeah.
Mobilizations, MINEPs, whatever. And then you kind of just, it's like, yeah, like here's the cost of the visit or the package. And now 90 or 95% of your patients receive red light therapy, I guess, unless they request not to, or they're scared of it or something, or what?
Either they request not to, or I mean, there's some people like you can only put one person on the unit at a time. So if say our schedule slammed with red light people at 5:30 p.m. for weight loss, which they need it for that, and then I got a PT person and I just can't squeeze them in, then I just won't offer it, and I'll knock the price down. But I recommend it with pretty much everyone, and we find a way to get them onto it. But yeah, how I present packages is do the DV, then do the eval, see how they're responding. Think you need 10 sessions. That's going to be, $2,490. Do you want to do cash, card, or check? Cash or check, you get a 3%. There is a 3% fee for cards. You can use your HSA. I just assume the close. So when I talk to people, I just assume that they're going to buy. They're coming to me for a problem. I present a solution. That's one of the things I'll teach my staff and other people is assume the close. Don't ask them if they want to do it. I've made that mistake before. Why are you going to ask them? Then it seems like you're unsure and you don't know what you're doing. Are you going to say, do you want to come to physical therapy? No, you're going to say, hey, you need to go to physical therapy. Your doctor doesn't say typically, do you want this antibiotic? No, they recommend that you take the antibiotic and you don't question it. You just take it. Right. Have a reason for doing it. You should always have a reason and be able to back it up. But you should assume the close, and it's been a game changer in terms of separating myself from other businesses, providing a different service that they're not going to get elsewhere, and then being able to charge a premium. So, we're on track right now. I've been out. I had back surgery May 19th. Today is July 24th. I've been out since then. Really, I'm starting to get back to work a little bit. But my staff, we're hitting record numbers right now. There's several different reasons for that, but this is definitely a part of it. My staff is slammed. And it's nice that we're hitting these numbers without me having to be there. So, yeah.
That's awesome. And so with you being out with that surgery and recovery and everything, your staff is taking the lead with treatment and everything and the rest of your service offerings.
Yep.
That's a whole other tangent, because we talk about practice owners that should eventually or ideally be closer to be an absentee owner. I think you're way too young, but the other practice owners that are looking at, exit or sell, certainly something to think about. Another thing real quick, you had also on Facebook or somewhere said something about in-network offices, maybe partnering, maybe acquiring an in-network office. Reimbursement is plateaued, or in some cases declined with inflation. It's less basically than it was years ago. I could see a lot of in-network offices adding red light therapy the way that you do, as having the red light therapy for lead generation to physical therapy, or the physical therapy that's in network, the services, adding red light therapy during the plan of care, maybe after the plan of care. There's a whole host of benefits, but why is that something that you've looked into recently? Why mention that you're potentially looking for in-network, other than obviously it's low barrier, the barrier to entry of people just, you take my insurance and the answer is yes, and it's just easy. There's no sales process. It's more cost effective. It's less out of pocket. Why did that come across you, and why did you put that out recently?
Again, I'm always looking to solve problems, and sometimes I like to bite off more than I can chew, and my wife will yell at me about that. But I find it fun, right? So again, I'm kind of like you, Dave, where it's I have an entrepreneurial mind and spirit, and I am always looking to improve. And so one of the issues that cash practice owners, you get out of the in-network model so you don't have to deal with insurance. However, as you know, and any cash practice owner knows, that question comes up every single time, and you have to be able to approach it 9 times out of 10 at least. So with that, I was interested because of kind of opening up a side clinic, and if that's possible, in Grand Rapids. So it's we get people in at fuel, and you want, you're dead set on using your insurance. And why would I not then send them to someone I know, know, and trust? And there's my other business over here that does in-network. That would be definitely a different model.
Instead of sending them to NovaCare, where you used to work.
Yeah, exactly. So the thing with that is that the other problem I'd have to solve, how do you keep your PT clinic, PTs happy, right? So, because if they know I own these 2 clinics, and over here, you treat one-on-one all day. And over here, you're probably going to have some overlap, because that's the reality of it. If you accept insurance, unless you want to take a lesser rate, you have to, and maybe I leave it up to that. Maybe it's hey, you call your own shots. And I think maybe that's how it is. Maybe that's how it's done. You call your own shots. You can treat how you want. You get X amount based on that. So I do know, I think some clinics are going towards a per session basis, right? You see X amount of patients, you get X amount of dollars. It could be something like that. That'd be a problem I'd have to solve though. So if you, and some sort of bonus pay, but that'd be the thing that I'd have to solve. Is them being well, it's not fair. I want to work at fuel. I don't want to work at Grand Rapids in network physical therapy where I have to treat 12 patients a day or 16 patients a day. And it'd be a different model. Like that wouldn't be for like, we'll see athletes, but like, and I tell people this, you can go wherever you want, but Fuel, like if you want the best care, you want to get better and you're an athlete, you're in the right place. But if getting better doesn't really matter and you just want the cheapest rate on whoever's going to accept your insurance, yeah, go right down the road. There, we have three of them right around us. Just go to pick one, call them.
Got it. Final thoughts to wrap up. I'll give you a second for them to reach out to you and where online or whatever. But what's like a final take here? I mean, I'm impressed. I'm super interested. I need to go try it myself just to kind of see who's got it here in the New York City area, and maybe try to find someone that maybe has a unit similar to yours or like the whole supine,
I'll look them up for you. I'll look up a place for you, and I can give you some recommendations around there.
Please do. Cool. So what else? Practice owners watching and listening. Yeah. I think if you're watching or listening this far along, you went from definitely skeptical to maybe a little interested the way that I am. And I think it doesn't really fit in my business model because we're going to patients' homes or office and workplace and all that.
It won't work for you. It's not for
brick and mortar.
Yeah, if more for brick and mortar. But if you're interested in learning more, I will say for you, Dave, what you could do is if people are interested, sell one of the home units. That's if you want an affiliate link, I can help you out with that for Mito Red Lights, who I recommend. But if you're interested in learning more, I would recommend I've created a Facebook group. It's called Red Light Therapy for Healthcare Professionals. We can share the link on that. But in that Facebook group, I'm trying to always post content that's just science related, a little bit of maybe some business strategy if people want, success stories, things like that, and really be a place for other healthcare professionals to learn more, because most people are in the same situation where I was 2 years ago, and I didn't, really know anything, and I'm just trying to sift through it all, and it's confusing, very confusing. So it's kind of like, I don't know, start up a cash practice and go reach out to different cash owners on how to do it, and you'll get like 10 different answers, right? So I guess a little different than that, but this is a good way to like learn more about it before you dive in. Ask questions, whether it's to me or in the group, and I'm happy to help try and direct you. But there are people out there. Like I had a meeting with a lady who was asking questions. I'm not afraid to tell you it's not for you. So for mobile practices in New York, it's not going to be, I wouldn't recommend it. Another lady, her hours weren't enough. Like she only wanted to work she only wants to work 12 to 15 hours a week. And I'm like, honestly, you're going to be too busy and the equipment costs too much. So unless you get someone to partner on it with you, then maybe you look into it, but you got to make it work for your business. So it's got to work for your patients. It's got to work for your business in order for it to work for you.
Awesome. We will, in the show notes, we'll link to the Red Light Therapy Facebook group that I'm in. It's super interesting. And PDF, the link to the ebook here. I got nothing to sell you or pitch you, but Eric can certainly walk you through some of these things. And I think this is interesting. I think it's something that there's patient consumer demand. They're going to go somewhere for hands-on, stretch therapy or some form of, pain relief or neuropathy treatment or red light therapy, right? And so why not potentially be the ones offering it? Just like a little bit of an aside, like there's a practice owner, Stephen Rapicelli, who's got like 3 or 4 locations, physical therapy practices in Delaware. But then he also he made a separate company called Stretchplex. And Stephen, if you're listening, I've been trying to get you on the show, so hopefully you can get on here. And he created a separate company with separate brick and mortars, and they're called Stretchplex. And it's just the assisted stretch places, right, in the Delaware area. And he probably refers his physical therapy patients, to that place, and then the place that the stretch professionals can't get someone better, he probably has them trained to refer to the physical therapy office that he owns.
Literally what we're doing. It's literally what we're doing at Fuel, except for it's all under the same roof. Yeah. Yep. And why wouldn't you do that? Again, you're solving people's problems.
And these consumers, like I said, they have these challenges, these issues. They're seeing things on Instagram and TikTok and all over the place. And there's going to be practices and professionals and different companies that offer this. And so why not Why not? Why not us? Why not physical therapists and practice owners offer it for something that's pretty much in our wheelhouse? Just because we didn't learn it in school does not mean it's not in our wheelhouse.
If you're only practicing based on what you learned in school, like I graduated in 2014, I'm in trouble. Like, yeah, you need to evolve. And yeah, so completely agree.
And to recap, so minimal side effects other than the intensity there. You check with your manufacturer to make sure that you don't have your patients or clients getting blisters. Minimal side effects. Consumers are looking for it. What about email, website, LinkedIn, Eric, Facebook for audience to reach out to you, connect further if they want to chat or if they have any questions?
Yeah, so my email is Eric, ERIC, at fuelphysicaltherapy.com. That's all one word. My website, if you want to check out my business website, it's fuelhealthwellness.com on what we're doing in Grand Rapids. And then so Instagram, you can find me, Dr. Eric Broadworth, and Facebook, just Eric Broadworth. And yeah, join the Facebook group of Red Light Therapy for Healthcare Professionals. If you want to do that, feel free to, again, DM me, email me. And I try to connect as quickly as I can. So yeah. I will say, like, I don't know if you noticed this, Dave, but like people's messages, like I think get lost in Facebook. Like it doesn't go through unless you're a friend. Because I've sent people messages and they're like, I never got that. And so then I've had to send them like emails. So if you're gonna I would recommend probably email or Facebook friend request me, then message me if I'm not answering.
There you go. Connect with Eric. If you guys find this interesting, valuable, insightful, subscribe to the Dave Kittle Show on YouTube, iTunes, and Spotify. If you're a practice owner in the New York and New Jersey area, Philly area as well, looking to exit, looking to have a partner like me that's a ton of energy and help you offload some of the things that you don't like doing, like the admin and the billing and like recruiting and interviewing and any other HR stuff or whatever, reach out to us. Maybe we can partner. We can have a discreet conversation. If you are in the Michigan area and looking to sell your in-network practice, I got Eric Broadworth here. You can reach out to him. He might be interested in that conversation discreetly and professionally. You
just made me think, hey, Dave, if you want to potentially partner in Michigan, maybe we should have a conversation. We could just open something up. So it's another idea.
Never know.
I'm not opposed.
Love it. Dude, so pumped. Super proud to see how far you've come from a W-2 job with NovaCare to what you're doing now. And you're helping patients, you're helping consumers, you're helping clients. Love what you're doing. And maybe we'll have you back with some other red light stuff or some other, cash pay, private pay stuff, because I know a lot of practice owners can benefit from this stuff because of payment and reimbursement concerns, and therapists are asking for more money. Other costs are fairly fixed. And if reimbursement and payment is fixed, then there's got to be other things to supplement it. And red light and assisted stretch or other private pay out-of-pocket things could certainly be the case. And you don't have to be in a big metro like me. You could be in Grand Rapids, you could be in other rural areas, and it could still be something that patients and clients will pay for. Yeah, I agree. 100%. Cool, man. Thanks a lot for your time. Talk soon. Yeah, thank you. Appreciate it. Hey, it's Dave Kittle. Are you a healthcare business owner or physical therapy practice owner who is looking to figure out your succession plan or exit strategy? We might be able to help. And in fact, we may be interested in acquiring your practice. If you're interested, you can reach out to me. Shoot me an email at dave@conciergepainrelief.com. That's DAVE at CONCIERGE painrelief.com. Or you can call me at any time, 646-781-8884.